Co-design is a process in which non-designers engage with designers in a process of exploring how products, services and systems can be reimagined, redesigned and then delivering on those designs. Co-design is also about bringing in and valuing the expertise of people who use product, service and systems or deliver products and services and systems. Human-centered design offers the ability to consider not just how people have engaged with their health and well-being or with a product, service or system, but how they may engage with it in the future. So it's that anticipation of what may happen and people's reactions to different scenarios or different future scenarios. And this is how we can engage people in the conversation around what could be better, and how things could change. There is a huge component of our work which is participatory, so falling into the participatory design and co-design paradigms. And then there's a range of technological ways in which design interacts as well. So that's where the practices of designers in terms of making things and their relationship with materiality. So using objects, images, media as ways of provoking and catalysing people to think differently and to communicate differently. So to think about their experiences and communicate and express those differently, and to think about the possible future scenarios and how they may or may not relate to those. LuLab is an example of one of the Lab for Living projects in which we explored the design of domestic bathrooms for older people. And in this project, we recruited 10 older people as co-designers, gave them training in design and research, and sent them out to co-design and co-research with their peers in the community. So another example of a Lab for Living application of co-design is in a huge body of work by Claire Craig exploring dementia care in acute care home and community settings. In these places, Claire has used games and co-design games and prompts as a way of enabling people with dementia to reflect on their experiences and share those with other people. The whole notion of co-design and participatory design has obviously been massively disrupted by the global pandemic and COVID and the national lockdown that we experienced here in the UK and other countries also experienced. So this opened an opportunity in terms of co-design into really looking at and reflecting on how we engage with people and how we use digital platforms to enable people to engage, but also how those digital platforms can also sometimes be a barrier to how people engage. So during the past 18 months, there's been a number of different projects that we've looked at. There's the Whole Mouth Health Project, which was an international project. So we worked with people in Australia, Nigeria, Chile, Switzerland, and the UK. And we were exploring the idea of oral health literacy as a primary strategy for supporting long-term oral health and oral health behaviour. So if people know and understand more about what makes their mouth healthy or unhealthy, then they will be more empowered to have control over their own behaviours and the decisions that they make, and in the long term have a beneficial impact on their own oral health and reduce demand on oral health services. This whole project occurs during COVID, so trying to engage people from all of those different time zones across the globe was a real challenge, and we had to amend our original plans, which were pre-COVID designed, to develop a series of packs, booklets that went out to people as a way of probing their knowledge and experiences of oral health over their life course. So this mapped sort of life journeys of oral disease, oral health and oral care, and people's memories of those